When we listen to the radio, we never agree on the station.
Classic rock.
Hip-hop. Pop.
Guys, quiet. The one thing we do agree on, we all want an awesome free phone. That's why we switched to Metro PCS.
Stop by Metro PCS with the whole family and get 4 free phones of your choice from brands you love, like Samsung, Motorola, and LG when you switch. Metro PCS. Wireless. Figured out.
Coverage not available in some areas. Sales tax not included in phone price. Free phone requires port. Excludes numbers on the T-Mobile network. See store for details and terms and conditions.
Blog Talk Radio.
World won't get no better if we just let it be. Na 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 na. The world won't get no better. We gotta change it now, just you and me.
Welcome to What's New with VHHughes. I am your host, Venus Henderson-Hughes, and my guest chair is Christopher Hughes. Welcome, Christopher.
Thank you, Venus. Good to be here.
So today we're going to be talking about Black History Month, and then we're going to flip the script and talk about some disparities. So starting out, we're going to begin talking about a few prominent African-American doctors. First off is Benjamin Carson. Benjamin Carson is the director of pediatric neurosurgery at Johns Hopkins. Born into poverty when he was 8, his father abandoned his family. His mother was a domestic who eventually sparked his love of learning. He was transformed from the dummy of his 5th grade class to the top scholar of his school. He dreamed about being a doctor and entered Yale University on a scholarship, then graduated from the University of Michigan Medical School. At age 33, he became the youngest chief of pediatric neurosurgery in the nation, where he developed techniques that saved hundreds of hopelessly ill children. The pioneering surgeon is the recipient of many honors in tribute to an extraordinary role model who has overcome rage, racism, and poverty to live the American dream. Next, Rebecca J. Cole, born in Philadelphia, Pennsylvania, on March 16, 1846. She was the second United States African-American woman physician and was the first Black woman to graduate for the Women's Medical College in Pennsylvania. Rebecca Cole received her secondary education from the Institute of Colored Youth, which is now Cheney University. She graduated from ICY in 1863. Rebecca Cole received her medical degree from the Women's Medical College in 1867. She was appointed as a resident physician at the New York Infirmary for Women and Children, which was a hospital owned and operated by women physicians from 1872 until 1881. Dr. Rebecca Cole worked with Dr. Elizabeth Blackwell, the first white American woman physician, to receive a medical degree. Dr. Blackwell assigned Dr. Cole to the post of the sanitary visitor, a position in which a traveling physician would visit families in their homes in the slum neighborhoods and instruct them in family hygiene, prenatal, and infant care. Dr. Cole practiced medicine in Columbia, South Carolina from a time and returned to Philadelphia to open an office in South Philadelphia section of the city. In 1873, with the assistance from a fellow physician, Charlotte Abbey, Dr. Rebecca Cole started a women's directory to provide medical and legal services to destitute women and children in Philadelphia. Dr. Rebecca Cole practiced medicine for 50 years. Next, Albert G. Crenshaw. He was born in Philadelphia, Pennsylvania in 1952, the second son to a construction-working father and a mother who was a domestic worker. At 3 months old, his parents separated, prompting a move with his older brother and his mother to a rural setting just outside Charlotte, Virginia. His mother was the sole provider to him, his older brother, and his next brother and sister that came later. In high school, he was an average student, but better than average basketball player. His sports awarded him a partial scholarship to Cherry Junior College, where he graduated with an associate degree in 1973. Afterwards, he attended West Virginia University, having quit basketball, majored in PE, but at his mother's encouragement, he later changed and graduated with a degree in biology in 1977. He moved to San Diego with thoughts of attending medical school, but due to not so good grades, decided to strengthen himself with a scientific background in another way. After a year of trying, he finally landed a job as a researcher in a laboratory at the University of California, San Diego. In 1983, an exchange sent him on an 8-month stint to Gothenburg, Sweden. He returned to San Diego and worked a few more years, and then in 1989 relocated with the lab to NASA, just outside San Francisco. During the year at NASA, he was invited and accepted a position as a PhD student again in Sweden, but this time it was in the north, in a little small town called Umeå. He moved there in 1990, finished his PhD, and in 1994, and still resides there with his wife and 2 kids, working as a professor of physiology. And lastly, our Surgeon General, Dr. Regina M. Benjamin, MD, MBA, was appointed by President Barack Obama as the 18th United States Surgeon General in July of 2009 and served a 4-year term. Dr. Benjamin also oversaw the operational command of 6,700 uniformed public health officers who served in locations around the world to promote and protect the health of American people. Dr. Benjamin served simultaneously as Surgeon General and the first chair of the National Prevention, Health Promotion, and Public Health Council, a 17-cabinet-level federal agency that developed a roadmap for the nation's health national prevention strategy. Before becoming America's doctor, Dr. Benjamin served her patients at the rural health clinic she founded in Bayou La Batre, Alabama, keeping the clinic in operation despite damage and destruction inflicted by Hurricanes George and Katrina and a devastating fire. She has a Bachelor of Science in Chemistry from Xavier University in Louisiana, an MD degree from the University of Alabama at Birmingham, and an MBA from Tulane University. She also attended Morehouse School of Medicine and completed her degree in family medicine residency in Macon, Georgia. Dr. Benjamin is a recipient of 22 honorary degrees. Chris, what do you think about the advances that we have in healthcare at the moment, with all these people who have come before us and now up to the present with Dr. Benjamin, who was our Surgeon General? She's not the first African-American Surgeon General, but just the fact that she is there or was there, because I know that we are getting a new one, but the fact that we had so much progress in healthcare?
Well, that's a very good question. It's almost the same thing as far as our medical advancements. In years past, using leeches, for example, was the best thing to do to cure some certain ailments, or castor oil was the main go-to to alleviate a lot of diseases or sicknesses for people. So I have to commend a lot of the advancements, trials and errors, physicians and scientists that gives us the forefront in medicine and operations today, allowing to save more lives than ever before. I find that very amazing.
It is. As a public health major myself, with a degree, I do find it fascinating that medical science has given us so much to make us healthy and keep us, healthy in various ways, not just weight-wise healthy, mentally healthy, just being structured completely and knowing that, you have these advances out there, so there's never a case where you can't be helped.
And then with that, that's also not only a healthier aspect of life, but be able to live longer and be with your loved ones that much more. So, amazing advancements.
So when I think about our progress, and we've had quite a bit of progress over the years, from not being able to see a doctor in any hospital and now being able to go anywhere, we definitely should have a lot more progress than what we have. And where I'm going with this is that our highest rate of disparity for us as a black people is heart disease. We're dying. We have a top 10 of leading causes for African Americans, and number one on the list is heart disease. We had one of our doctors, Dr. Charles Drew, specialized in heart medicine, and yet we still have heart disease as a number one issue. Now, I know that I had a Southern grandmother, so of course I know about all of the soul food, if you will. Now, truthfully, some of that soul food was really healthy. The greens was healthy. No, the fatbacks and turnip greens and all that all together may not have been healthy, but the greens themselves were healthy. So what is it that you believe, Chris, that, now in this day and age, where we walk around with computers in our hand, our cell phones, our mini computers, or we carry our computers with us, why is it that we still have heart disease as one of the number one disparities for black people? We're looking at the fact that we are still dying daily from heart disease.
No, I believe that a lot of it has to do with just choices from people. You mentioned about some of the Southern upbringing, and with that, your food. A lot of people in our culture enjoy, the greens and cornbread, the hummus and cooked in additional fat and fried chicken.
Chitlins with the hot sauce.
Yes.
I've been, and I can admit I had my moments with that. I'm not ashamed to admit that. According to the CDC, about 600,000 people die of heart disease in the United States. That's every year, and that's 1 in every 4 deaths. And heart disease is the leading cause of death for both men and women. More than half of these deaths are due to heart disease, according to 2009 statistics.
Mm-hmm.
Where it comes down for African Americans, that's 24.5% of us that are dying. in relation to 18% for American Indians or Alaska Natives, Asian Americans 23.2%, Hispanics 20.8%, and whites 25.1%.
Mm-hmm.
So we are up there, and of course whites are high as well, but that is our number one cause of death, and that is scary because I know growing up in Detroit, Michigan, my grandmother had a heart attack, and it was the scariest thing because you never seen such a strong woman, have to be carted out in such a vulnerable state, and I know that your grandmother had a stroke.
Yeah.
So, just those things that we grow up in, it's seeming as though in our community, as the black community, is commonplace, and it shouldn't be. Callers, feel free to, call on in and join the conversation, if you will. Our next disparity for us in the African American community is cancer, which touched me up close and personal. That is our very next disparity, right up under heart disease. And for me, and I remember having a conversation with my grandmother, and she told me she started smoking at 8 years old. I can't imagine at 8 years old smoking cigarettes or anything else under the sun.
I agree with that, but unfortunately, especially in our day and age, kids are getting younger and younger to get into things that necessarily they're not supposed to, not willing to wait till they're adults to do so. I'm not surprised by that.
Well, I know that it came with being out in the fields. I know that because they were in the tobacco fields, so I know that was a part of that division of the culture. If we were to flash forward to this day and age, we would not expect to see an 8-year-old smoking a cigarette. Then there was it seemed like they had more of a maturity in there because they had to grow up faster because of the way things were in their era. I know for sure that, majority of us probably wouldn't have lasted in their era coming up.
Agreed. There's an interesting thing I was talking with someone today as far as the fact of the whole issue of having large families. And the gentleman I spoke with made a point about the fact that back in the day, large families were basically paramount because the siblings or the kids were bred as far as helping out with chores on the farm, for example. The farmer wasn't necessarily able to afford getting or hiring help, so the kids were paramount in helping him be able to take care of the lands and get the eggs from the chicken coop and milk the cows and stuff, and be able to chip in that way to provide and help out the family.
So when I think about my grandmother, who indicated that she started smoking at 8, and knowing that in 2000 she passed away from lung cancer, so we're talking a huge span of time because she was born in 1920. So we're talking a huge span of time that she was smoking. So she has been smoking all that time, and even up until probably a few months, I think, right before she passed away, that we actually got her to stop smoking, which, the damage was really done. I mean, the damage was done, but I guess there was this whole thought process from the doctors, and us included, that, okay, well, maybe you should stop smoking. But, damage was done. She was already at stage 4. The acceptance in our community with smoking, the fallback on it, and yet smoking is not always a cause of lung cancer.
Right.
So it just so happens that when it came down to my mom and my grandmother, that was their cause. But there are other forms of lung cancer that happen. So we hear lung cancer, we automatically go to, they were a smoker. But that's not necessarily true.
Agreed. Working in factories with asbestos as a carcinogenic agent also could be a cause for cancer building up.
And of course, growing up in Detroit, and we had the auto industry, and which I hope that it's making a comeback. But I know that in working in those factories, you were exposed to quite a bit of different chemicals, depending on where you were in the factory. So you can see where, a lung cancer or cancer in itself, because it necessarily doesn't have to be a lung cancer, but a cancer in itself, because you're being exposed to so many different chemicals that you're not even aware of, because, of course, you're just going to work to do a job and take care of your family, and yet these chemicals, of course, have ravaged your body, and you don't find out till later on. And, another aspect, of course, with the growth of cancer, if you will, is the fear, if you will, of going to the doctor.
Right.
And that's another issue that sort of puts us in these disparity rankings, if you will, because of the fact is that we don't want to go to the doctor. We don't want to go to the doctor until it's getting to the point where we can no longer take that pain, or we can't raise our arm so high, so we might as well go and check it out, or whatever. And I experienced that with my grandmother. We would rather self-medicate ourselves instead of just going to the doctor. And I'm not saying to go to the doctor for every little, pain and inkling, but I know that my grandmother had sisters, and it's funny because they all sort of favored each other. And she had a sister, and this one particular sister, she refused, and she lived in Virginia, and she refused to go to the doctor until it got too late. And when she went to the doctor, she found out that she had diabetes, and her diabetes was so bad that they had to amputate her leg. Mm-hmm. Now, this lady, this my Auntie Polly, she was very active. And so imagine the feeling of a Southern woman, not just a Southern woman, a Southern black woman who is used to staying in this big old house by herself, who is used to taking care of her own self, only to have her leg amputated, and now she has to have somebody come in and take care of her. But she didn't go to the doctor because she didn't feel like anything was wrong. And then when things started going awry, if you will, then she goes to the doctor. By then it's too late.
Well, that unfortunately that is a kind of a stigma in our culture, particularly with the fact of being able to afford health care as a staple. Even when someone's able to afford health care, is just the fact of, we are kind of bred with seeing our parents or older folks persevering through their pain and ailment. So we kind of have that fall on us as well, that if it doesn't take me out altogether, that I can't work and keep doing what I got to do, then I'm only, push through regardless. So unfortunately, that is kind of a stigma with our culture.
What do you think as we get older? Because we're in our 40s, so as we're going on and we're getting older, do you think that it's part of the social norm in our community just to look at the medical community as you get older as untrustworthy? In what, as far as going to the doctor or trusting in our parents to? Well, just trusting into the medical, when I experienced working in the hospitals and things like that, and I saw some of the mentalities of some of the doctors, that whole treat and street mentality, that I can see where people don't have the trust in the doctors because of the fact is that the doctors just, in their mind, they're to get a paycheck. They have this preconceived notion that the universities are turning out all these doctors, and all they're looking for is that gigantic paycheck. Mm-hmm. So I believe that, in the case of my grandmother, your grandmother, and other elders, that whole mentality is there. They're only there for that money. They're not there because they care about me. Right. So do you think we're going to fall in, because now we're like I said, we're in our 40s, do you think it's just automatically a thing that as you get older you become more cynical about the medical community?
I think there's always concern regardless of who you deal with, and I agree with you. I've seen some big shares of that when I worked for the hospital, as far as the fact that the doctors and nurses were just there for the paycheck aspect or care with the patient instead of being nurturing towards the patient and trying to put them at ease depending upon what the situation is for them. So, but in that, I think more people are pre-game to that if something's really wrong with me, I need to go to the doctor to see what's going on so I can take care of it and then keep doing what I have to do. When I was working at the hospital, there was a young lady who, she wasn't predisposed as far as that. She got a sniffle, she had to go to the doctor type thing. But it got to the point where her kids had some type of like high fever, whatever. She would take them to the doctor, on the jump. It wasn't okay, well, let's just wait and see, or let's get something over the counter or whatever. She wanted to make sure her children was okay. So for her example, I presume other people feel as she did that push comes to shove, something goes up with your children, yourself, whatever. They are still trusting in the medical community to take care of them, make sure that they get the right diagnosis for whatever they have to cure them or help them out so that they can keep on doing what they got to do to take care of their family.
Well, our number 3 health disparity for the African American Black community is stroke, and you know about that one from your own personal experience with your grandmother. According to the CDC, stroke kills almost 130,000 Americans each year, and that is 1 out of every 19 deaths. On average, 1 American dies from a stroke every 4 minutes. Every year, more than 795,000 people in the United States have a stroke. About 610 of these are a first or a new stroke. That's a scary statistic for me, definitely, because I know that a lot of some of the stroke statistics or symptoms or, the symptoms, stress is a huge factor in a stroke, and knowing how to basically give yourself a time out, which I'm very bad at. Not to say that I'm, really walking down stroke lane, but that is something when you're just always on the go. I got to do this, I got to do that, I got to do this, and not giving yourself and your body time to rest.
Now that does affect all nationalities, and big families in particular, especially if you're the only income coming in for that family. Yep. The basic stress factors of taking care of the household, make sure the kids or whoever living there not only are doing what they're supposed to do are all right. Maybe you're not necessarily there to prepare dinner, but you want to make sure the food is there for them to cook or whatever the case may be. So stress does, to me, play a very important factor in the possibility of someone, unfortunately, getting a stroke.
Now, one of the things that the CD states is that stroke is the 4th leading cause of death for Americans, but the risk of having a stroke varies from race and ethnicity. Risk of having a first stroke is nearly twice as high for blacks than whites. And blacks are more likely to die following a stroke than whites. That, we were blessed. Of course, your family was blessed that your grandmother did not die from her stroke.
Right.
That in itself is amazing. But the fact that we are twice as likely as black people to die from a stroke, and I know people who have had stroke and they've managed to, as we say so casually, bounce back to their old selves, whereas that some never come back. Some people never get that that ability or that feeling which side was affected or somehow they're paralyzed. That in itself is a scary thought.
Agreed. But see, that's why organizations like Henderson-Hughes Health Partners and other agencies are out there to hopefully be able to educate people on factors like this. And God forbid something happens that, a person does have a stroke. Hopefully there's someone around to be able to call 911 or be able to implement some type of medical, some type of, know-how in order to get that person the best care as possible to help them out before it gets any worse. Because I do know early gain of getting the stroke in check is beneficial for have that person get as much of their
faculties.
Yeah, the faculties of their movement back after the stroke.
That's true. We can always talk about prevention. A lot of times what I see, and even though we have this information out there, we have the information out there regarding heart disease prevention. We have information about knowing your body per se when it comes down to looking for things like cancer. Like, okay, we're in Arizona, and one of the things about Arizona is there's plenty of sun out here, and we're all susceptible to skin cancer. Even us darker shade people, we're still susceptible to skin cancer. Now, one of the myths that I know I grew up with, I'm not sure about you, was that because we were darker, we didn't have to worry about putting on suntan lotion and things like that because our skin shaded us from that. Well, that's not true.
Right. Right.
We are still susceptible to skin cancer. And, of course, out here in Arizona, there are plenty of doctors out here that specialize in skin cancer. And you have to be, mindful of what your skin is doing and what's on your skin, and it's how you feel, period. You have to be in tune with yourself. And I think that we are in such a fast-paced society that we forget to actually be in tune with ourselves. I think we are so busy, we're so automated, we're so on the go, that we forget to take time out to spend it with ourselves.
Well, I agree with that. There's a lot of through work, through recreational play, hiking, going mountain bike riding or whatever. It doesn't really put pause for an individual to say, hey, maybe I need to, check myself out, make sure I'm okay or what could it be, because as far as you're concerned, as long as I'm able to do these things, it's all good. It doesn't get to the point. It doesn't get to the point until a certain ache comes about or a constant headache comes about that a person will be like, hey,
the constant headache thing, you stepping on my toes, but okay.
Well, I'm just saying in general, unless something makes the body go through the fact that, hey, you know what, you might need to take care of this. We don't really worry about it or we don't really think about it. You have people still going to the golf courses or sledding down a slope in Flagstaff, and they're living their life, which we all want to do. But at the same time, you still want to be mindful of your health and your limitations.
That reminds me of, what is that, prevention is worth a pound of cure? Is that the saying?
I believe so.
And we do need prevention. I think if we actually took the time out to actually be in tune more so than we are to see in the latest reality show or whatever, and actually taking time out for ourselves and learning what it is and seeing what that ache is. Is it just that you slept wrong, or is it that there's actually something wrong with you?
Right.
There's nothing wrong with going and being checked out. It's better to be safe than sorry. Our fourth disparity is diabetes, which I honestly thought that diabetes, especially because we see so much about it, will be a little bit higher on the ranking. But diabetes is definitely a huge problem for us in the black community.
Right. I'm interested as far as that. The comedian and actress Sherry Shepherd from The View has a book out as far as her stage 2 diabetes, and wrote that to help other people not be afraid of the disease or the condition, and hopefully be able to inspire them to get themselves checked and make better choices as far as their eating and exercise to help them out with the condition if they have it.
Well, the thing is that you're looking at genetics, a lot of times with diabetes. My mom and my grandmother had diabetes. Now, when my grandmother passed away, her diabetes had somehow subsided itself, so it wasn't a trace of it in her body. My mom, on the other hand, still had diabetes. When my grandmother had diabetes, she was able to take tablets. My mom had to take insulin. So they had varying versions, if you will, of diabetes. The diagnosis of diabetes, almost when you talk to somebody who has diabetes, when they first find out, it's like they received a death sentence.
Right, it's still a stigma in our culture that diabetes, like, you got that, type thing. But it is manageable, and if caught early, it can be lived with, and you can have a normal life. You can have a normal life. I know some people, who have, diabetes, and they function really well with it. They take care of themselves. You would never know. It's not one of those things where you can run up to them and look at them and you just know and point your finger and go, I know you have diabetes. It's not that simple. And for the record, every plus-size person does not have diabetes. There are some skinny people out there that have diabetes, and you would never know it because the whole stigma is that, when you gain the weight, of course, you are at risk of getting diabetes, right. But it doesn't necessarily make you have diabetes. The fact that diabetes affects your whole body, like I said, with my grandmother's sister, she ended up losing her leg because she wasn't taking care of herself. So you have those people who refuse to take care of themselves and then wonder why they have to have a foot amputated or a leg amputated or an arm amputated or an eye removed. When you start losing limbs like that, that's a red flag for you. Well, I agree. I think, unfortunately, our culture, and not just black culture, but everyone does still suffer from that I'm young, I can conquer the world mentality, that nothing can, stop them or slow them down or whatever until, like you said, something comes up where you have to have a leg amputated, or the doctor gives you news on the fact that, you might want to stop smoking or something like that. Other than that, as long as I'm able to walk and get where I got to go, and I can go to the bar and have me a few drinks all I want to and have some beer. I can go ahead and be out later as much as I want to, whatever. Okay, but brother, you 50-something years old. I mean,
trying to live the life.
Exactly, trying to live the life, whatever, which, again, I'm always to each their own, but at the same time, sometimes you're going to have to take a kind of a step back and reflect on some things and understand you're not 20-something years old anymore. Even at 19, 20-something don't necessarily mean you're going to be able to get through some of the stuff that you want to get through like that.
And one of the things that I know that was never talked about when it came to diabetes was pre-diabetes. And I hear more people talk about that now because that's something, when you go to the doctor now, they can catch it ahead of time. Back then, probably around the time that my grandmother was diagnosed, that's all they knew about was diabetes. But now pre-diabetes is starting to come out a little bit more. And pre-diabetes is a condition in which individuals have a blood glucose or A1C level higher than normal. Mm-hmm. So when you look at that, and it's really making you susceptible to our number one and number two friends up there, stroke and heart disease.
Right.
So they're sort of going hand in hand. And I believe that we have more pre-diabetes because we have more good foods to eat. And I use the term good loosely. We have more sugar things out there for us to eat. As a matter of fact, when I made the comment about the Girl Scout cookies, I love Samoa Girl Scout cookies. And, couldn't wait. What was it, last year I wanted Girl Scout cookies so much I went on their website and actually looked up the schedule to see when they were going to be coming out in the neighborhoods. So I'm making myself susceptible to diabetes because I'm hunting down the sugar. I'm going to find this sugar, And then I made the comment last night when I ate one of the cookies and I felt like Cookie Monster because it wasn't just the one cookie. I had to have 2. I had to have 3. And it's ridiculous that we have these treats, if you will, but these treats are not really good for our bodies.
Well, again, that comes to the point of a matter of choice. Now, I don't know what the exact service size is for the Samoas or whatever.
It's 2.
Okay, well,
well,
unfortunately, Samoa and other foods, have the Pringle effect. You can't just eat one, and it gets to a point where, you have to just kind of balance it out. If I have 4 Samoas today, whatever, then I shouldn't have anything tomorrow. Some people don't care about that. It's like, look, I got Samoas, I'm gonna eat a Samoa. That's my choice, whatever. But at the same time, you put yourself at risk. So it's kind of balancing the good with the bad. Yes, it's all right to have a Samoa, but at the same time, you also want to balance that out with some fruits and vegetables, and some decent food, some fish and chicken.
And you got to move, and that's another thing. You have to move. I think we, especially in our wonderful technology age, we have so much stuff that we want to see on television that we have not. I grew up, and I'm not sure about you, but I grew up playing outside.
Mm-hmm.
I grew up with running down the center of the street. We used to run down the center of the street and race, in the center of the street. We used to walk places.
Mm-hmm.
That has changed a lot, and I know the technology is a big reason why. We have so many shows that we want to see that we don't take the time out to go for a walk. Something as simple as going for a walk around the block. That's not going to happen.
Well, also with the shows is in our culture now with Facebook and other sites for the whole communication online. We go to our smart devices or our computers and stuff to talk to people now. It's very rare that you actually meet with somebody, have to have some coffee or tea, for example, and talk one-on-one. As a rarity now. It's more so about texting and talking to each other via Facebook now.
It's interesting that you mentioned that about the technology part as far as the social media. I seen a post, believe it or not, it was on Facebook, but it mentioned the fact that as we take time to look at a Facebook or Twitter or whatever you're looking at, that life is passing you by. Life has passed you by, or you're missing out on what you should be interacting with. I think we also have a commercial. It was a recent commercial for Valentine's Day, and a gentleman was trying to give the lady her gift, and everybody in the cafe, I'm not sure if anybody has seen this, but I've seen it recently, but everybody was on a computer or a phone, and even his date across from him was on the phone, and he had to literally text her to say, look up. This is where we're going, and because we're so enamored with our phones and our computers and our TVs, our 3D TVs, and we forgot that we need to go outside and walk around. Mm-hmm. And nobody said you had to go run a marathon, because, I am a plus-size woman, and I walk around. So I'm not trying to run a marathon, but I am trying to make myself healthy so that I can be around to meet the next generations to come. I want to be able to do that, and I'm not going to stunt my growth by trying to see what's the latest thing on TV. Whatever it is, because we still have technology, we can DVR it. Mm-hmm. So we're not missing anything. So we really have no excuses when it comes down to being healthy. I love the Let's Move movement, which was championed by the First Lady and backed up by our Surgeon General, Regina, what's her name? Regina Benjamin. How did I forget her name? I just spoke about her. But the fact that those two women got together and created this for our children, but it's more so than that, because if our children are moving, we need to move too, because we have to keep up with them. Mm-hmm. So we all need to move. It's not just about the children. We could say that's the kids' campaign, and yes, it started out that way, but we need to move. We need to be healthy for our families.
Well, that is a big factor. Again, referring back to Sherry Shepherd, that was the main changing point for her, because for the longest time she enjoyed her fried food. She enjoyed having, an alcoholic drink or whatever now and then, and didn't say anything wrong with it. But it wasn't until confronted by her son on the fact that he wants her to be around for her, that it hit home, mm-hmm. that she needs to change her lifestyle.
You know what? You mentioned alcoholic drinks. Not many people realize that some of these alcoholic drinks have sugar in them.
Right.
There are hidden sugars in everything, and that's the thing that really hits home. Even our fruit, natural as it's made, they have natural sugars, and that's the thing that many people are not aware of, especially when you decide that you're going on a diet. And this is one thing that I was really a culprit of until I learned that you still need nutrients. You deciding not to eat breakfast is not good for your body. You're starving it. And the thing is that I didn't realize that because I was so busy trying to be on the go. We're going back to that on the go thing again. Mm-hmm. You're on the go. You haven't fueled your body. That's like you're getting in your car and having a quarter tank of gas, and you're going to drive out of state with it. You're not going to get far. Mm-hmm. You're not going to get far. We have to learn how to fuel our bodies. And no one said that, the things that you like to eat, if Samoa's, for instance, is something that you like, you can eat those things. You just don't have to eat the whole box in one sitting.
Exactly. There's a gentleman I work with that's trying to get himself back together. He started at 265, and I think he's working towards 203, 205, somewhere in there. And I think he's at like 220 now. And he's mentioned the fact that, he just got to the point where he was tired of feeling heavy, that every time he bent over and got back up again, he was out of breath. And he wanted to change his lifestyle. So he's eating better. He's exercising 1 hour every day after work. He gets up in the morning before coming to work to walk like a quarter mile every day. So he's doing what needs to be done in order not only to lose the weight, but to get himself healthier and not to feel as heavy as he does.
Nice. Our next disparity or leading cause of death for African American people are unintentional injuries. And unintentional injuries have to do with car accidents. You name it. Household injuries. We are the champions of do it ourselves. We think that we done learned something. What is it, the Do It Yourself channel? We watch that channel and we just take on the world then, and we have no idea what we're doing.
Well, it's really you should say that, because at my job, a lot of the service requests that are asked for as far as fixing this and could you repair that, could you put this fan up this or whatever, the fellows do have the knowledge for it. But it's been some situation like, changing batteries out, whatever. It's kind of commonplace on the fact of, just getting the right screwdriver for the job.
Right.
So, going back to your point as far as, accidental situations with, driving, for example. Out here in Arizona, you got a lot of, I can't sugarcoat it, bad drivers that, don't pay attention, are also on their phone, which definitely is against the law, but they still talk on the phone, busy putting on makeup, eating, reprimanding their kids while watching what's in front of them. It's just very bad situations altogether with people not focusing on the main thing they should be doing, which is driving, trying to take care of everything else.
That is true. When I think about car accidents, and especially I'm not sure how many people have heard about the driving here in Arizona. Everybody seems to be in a rush.
Seems to be.
Seems to be.
Whoa.
I'm saying seems to be. But if you are, I know one of the comedians has said something about the fact that if you drive the speed limit, you shouldn't drive on the Arizona freeway.
Okay.
So, and what I'm seeing more is a lot of accidents on the freeway, whether they're from your tire rupturing, and we see a lot of those here, or anything. But there are a lot of accidents, and that goes back to everybody being in a hurry.
Agreed. This up here, traveling eastbound on the bus, going to Mesa, Southern and 48th Street, seeing a car, I guess, call itself trying to make it past the light before it changed all the way through, and colliding with a car that was turning at the same time, who had the right of way. You know, just those situations like that you know, this not only boggles the mind, but makes you like, okay, where do you have to go so fast that you would, you know, put yourself in a situation like that?
They are definitely busy. Some of our other leading causes of death, looking at the fact that we're 10 minutes up, is that kidney disease, chronic lower respiratory disease, homicide, which was not a huge shock to me, septicemia, and last but not least is Alzheimer's disease. Now, going back to septicemia, which is sepsis, blood disease, it brings me to your cousin. Mm-hmm. When he hit his leg, and he did it, you know, he did a simple Band-Aid, mm-hmm. and he ended up having to go to the hospital.
Right, not realizing
because he got infected.
Right, not realizing that it was worse off than what it was.
So, do you think that because he's an older black man,
right,
and he's used to doing it himself, his simply going to the doctor or not thinking it was that bad? Do you think it was that whole mindset of saying I could just take care of this myself, I don't have to worry about it?
Part of it, from what he told me, it was a simple bump or whatever. It did hurt, but he just looked at it as a simple nick of the leg or whatever, and didn't think anything about it until later on that day he saw that the leg had swelled and turned blackened a little bit. So from that he like, oh shoot, wait a minute, something's going on. Now I don't know what the metal piece was from that he hit. Don't know what was on it, but unfortunately it had something to evade his body from that hit to cause the leg to swell and to start discoloring. So, it's just one of those situations you never know what's going on with the area that you work in. At my job, I've nicked myself several times, and my first thing is to use the water solution, the alcohol Perel solution, mm-hmm. and as well as the Neosporin in our medicine cabinet, just in case, because I don't know. What I think might be a simple cut or what it could be a lot worse because of what little microbes or whatever that's in that. Now it's in my system. So anything I can do to help prevent that or stop it altogether, I'm going to do.
Well, that reminds me of when we first got here and you were in the picking up some trash and you got nicked by a needle. And the fact that, because you worked at the hospital, you had to go through the whole chain of prevention as mm-hmm. far as going through, getting HIV testing and things like that. My thoughts about that, or why I'm bringing that up, is what happens to the person that may or may not work at the hospital that gets nicked by a needle, and they decide, you know what, it wasn't a big deal, I didn't bleed or anything, so I'm good, and later on they end up with a hepatitis or a HIV.
Right. it's always our choice to look at it, as major or not major, whatever. I think I mentioned earlier in the show, our culture is pre ordained as far as the fact of, especially looking at our parents who, work several hours a day without a hitch, and even if they were sick or in pain, they would still push through and persevere, and we kind of gather that as well. So for an individual, in my situation or like the scenario you just posed, you still got to be careful nowadays. You still got to be vigilant and aware that regardless of the fact that it might be a small nick, that small nick can turn into something more life-threatening to you. So it's always good to take prevention, like I mentioned, the water solution or alcohol solution from Perel, as well as Neosporin to help with those cuts that I received, from lifting up garbage or lifting up pallets. I think has helped me immensely preventing anything major, if that's the case, that will, from the cuts, from getting sick or being laid up.
Well, we got 5 minutes left in the show, and I do apologize. It looks like I've had some comments, but for some reason they're not coming through, and there might have been some callers. So I hope that when we have our second show on the 8th that I'll have a better hand of that. So I do apologize to you all for that. But speaking of our second show, if you don't know, February 7th is National Black HIV/AIDS Awareness Day. And so, with that said, my affiliation with the Arizona Black AIDS Task Force, I have requested that because of the fact that we're coming up on this day, this observance, if you will, that I would like them to come on, if not one, all, for them to come on and basically give a showcase on what they do here in Arizona for Black Americans with regard to HIV and AIDS awareness. Now, there's this one thing that I must make clear about that. Not everybody involved with the Arizona Black AIDS Task Force is African American, which is even more refreshing. And the fact is that we have not excluded anyone makes them so dynamic. They are definitely a great asset to me with Henderson-Hughes Health Partners and getting me any information that I need. They're great, and they have been in operation for over 5 years, and they have some dynamic people attached to them. It's going to be a great treat to have them here, speaking with everyone, educating everyone, getting rid of the stigmas with regard to HIV and AIDS, knowing that even though the statistics have went down, it is still a real disease that is affecting many people. And that in itself is something that needs to be talked about. And the fact that they're reaching out to not only just people in the community, but churches are getting involved, and sororities and fraternities are getting involved. So they are reaching a great demographic with people. And that is something that I'm going to love showcasing on next Saturday, the 8th, with them at 3 o'clock. So if you're not doing anything, definitely please tune in, and hopefully I'll have everything in order to get the calls and the chat. So it has been my pleasure to be your host with What's New with VHHughes and Chris Hughes. Thank you so much for being my co-host today.
No problem. Thank you for having me.
And definitely we'll be answering any questions and comments that you may have given us on the chat room that I didn't get a chance to read or see in this particular show. Definitely stay tuned and watch out for our calendar of shows that we'll be sharing. It has been a pleasure to be your host. And if you have any other questions for me, you can reach me on my website at h3p1.org or send me an email at vhhughes@h3p1.org. And this has been What's New with VHHughes. Have a great day.
Ho, ho, ho! You know, many find it hard to believe I own a sleigh that can fly. But you know what I find hard to believe? The unbelievable offers going on at the winter event.
The Mercedes-Benz Winter Event is back with incredible offers on the sporty CLA, the thrilling C-Class, the versatile GLA, the safe and secure GLE, the innovative GLC, and of course, the unequaled E-Class. But hurry, because these sleighs are going fast. Visit MBUSA.com/winter event. Mercedes-Benz, the best or nothing.
Ho, ho, ho! You know, many find it hard to believe I own a sleigh that can fly. But you know what I find hard to believe? The unbelievable offers going on at the winter event.
The Mercedes-Benz Winter Event is back with incredible offers on the sporty CLA, the thrilling C-Class, the versatile GLA, the safe and secure GLE, the innovative GLC, and of course, the unequaled E-Class. But hurry, because these sleighs are going fast. Visit MBUSA.com/winter event. Mercedes-Benz, the best or nothing.